With that. Yes, I'm recording now. Welcome to our meeting. Just kidding. But both post-COVID long hauler are simply symptoms that have not resolved over time. So the virus is here, the virus goes, and folks are still sick, right? How many of you guys know someone, or maybe yourself, who has had, you know, who has had COVID like weeks ago or months ago, and they're not fully recovered? They're like, why do I still have shortness of breath? Or why am I still having brain fog? And I see a few hands up here. Type in yes if you know folks who who have not recovered from COVID, despite the fact that that they've had COVID. Okay, that's it. Only four of us here. But yeah, there. But it's something that we see and we're hearing on the news. Let me ask you a quick question, guys. Why do we have, this post-COVID long haul problems? Why is it that the virus is gone, but the symptoms are not gone? Does anyone know? Drew says my wife is a long hauler. Yeah. Why is it that the virus is gone, but the symptoms are not gone? Suomi says inflammation. Lynn says damage behind. Ellen, yes, the lungs do take time to recover because of the damage that's done. Does everyone understand that coronavirus is a condition or a problem that is associated with inflammation? I think I've gone through this probably a bunch of times with you guys, right, over the last year. That when COVID goes to your lung, right? When COVID goes to your nose, to your mouth, and travels to your lung, it isn't the virus that destroys your lungs. It is the immune system in its attempt to attack the virus in your lungs that creates, what we call friendly fire. While it's trying to battle the virus in your lungs, it has, it's kind of like throwing like you got like, let's say you have a few guys fighting in the village, right? You got a few guys, two gangs fighting in a village. So I want you to imagine two gangs fighting in a village, beating each other up. They're like, battling it out. And somebody decides to throw a grenade up into the air with the attempt to try to kill the bad guys, the other side. Right? When that grenade that's thrown into the air explodes, who gets hurt, guys? Who gets hurt? Type in your answer. Who gets hurt? Right? When you got two teams fighting and a grenade is tossed up. That's correct. That's correct. Everyone gets hurt. Your immune system, our immune system, oftentimes in its attempt, right, in its attempt to fight coronavirus, our immune system oftentimes just throws up a grenade because it doesn't know what to do with a new virus that is never met before. And it is in its attempt, right, to fight this virus, it is like throwing a grenade into your lungs. And when that happens, everyone gets hurt, right? In its attempt to destroy the virus, it damages your lungs as well. It is caused by inflammation gone wrong. Does that make sense to you guys? Type in yes if that makes sense. Inflammation gone wrong when coronavirus is being attacked by the immune system, right? And as a matter of fact, we know that that chronic inflammation is the core behind most of our diseases today, right? Chronic inflammation is the core behind most of the diseases we have today. I gave a little lecture yesterday about CBD and the brain on Zoom. And I was telling folks, the reason most folks take CBD to try to treat whatever, issues they have is because whether it's arthritis and joint pain or anxiety or different conditions that is attempt to be treated by CBD, the reason CBD helps with pain and helps with the joint is simply because CBD is an anti-inflammatory, right? It stimulates what we call the endocannabinoid system of the body. And that endocannabinoid system acts, when it's activated, it is an anti-inflammatory, which is why CBD helps. But my point is that inflammation is the core of most of our diseases today. And I'm not talking about the short-term inflammation, like having a fever, right, when you're sick and your fever breaks within a day or so. I'm talking about more of the long-term inflammation, the inflammation that kind of hangs around. And when it does that, it is like throwing a grenade into your body, and that grenade explodes and hurts everyone with that. Now, let's go back to this COVID, post-COVID long haul situation. Does anyone know what systems in your body is affected with COVID long haulers? Long COVID, we call it. Does anyone know what systems in our body, is affected or damaged by COVID hanging around? Any thoughts on that? Any thoughts on that? Joanne says lungs, brain, brain, respiratory, circulatory, nerve. Wow, okay, you guys are naming like everything, guys. Many systems are affected, huh? Yes, yes. Very interesting. Bless you.
Thank you. Allergies.
Uh-oh, allergies. Is that like an inflammation issue? I'm just kidding.
Oh, lifelong allergies.
Got it. Yes.
Spring is special.
Yes, spring is coming. I'm looking forward to the spring, guys. I'm looking forward to some more sunlight. How many of you guys are looking forward to more sunlight? Yeah, I get depressed when it's like dark early. All right. So I want to explain to you and give you a little visual. If your body was a village, right? If your body was a village and the enemy has attacked the village, right? An enemy called coronavirus. And you have your soldiers defending the village, but they are fighting, right? In this village, they are fighting hand-to-hand combat. They're shooting their pistols and their guns. They're throwing grenades around. So this village of yours, your body, is engulfed, right, in this battle between the virus and your immune system trying to fight the virus. As this battle is enraging, what's happening is that the buildings around the village, right, they're getting shot at. They're getting bombed, they're crumbling. The roads, the lights, everything around the village, the infrastructure of this village is getting destroyed. How many of you guys have seen pictures of World War II and the bombs that came down Europe trying to hit the European cities? And you've seen these black and white pictures of damaged cities during World War II. How many of you guys have seen one of those kind of pictures before in movies or things like that? Most hands have gone up, right? Most hands have gone up. So here's the thing. Your village has been shot to pieces because of this enraging battle. But at some point in time, coronavirus goes away, right? You have recovered from coronavirus. The the virus disappears. It's out of your system. Your immune system have overcome it, and you've recovered, right? You quote unquote recovered from this infection, right? You test negative for it. When the virus goes away, when this virus goes away, what happened to all the damage of the town, the lights, the streets, and the building? Does that does that go away, or is the damage still there? Right? What happened to the damaged buildings that are around? Does it instantly recover, or does the damage hang around? So the enemy troops is gone. The virus have disappeared. But post-COVID long haul, right? Post-COVID long haul symptoms simply means, guys, the damage is still there from the battle that occurred. Does that make sense to you guys? What post-COVID long haul symptoms is? Type in yes if that makes sense to you, right? Yeah, type in yes if that makes sense to you. It is the damage that is left behind. Okay? So my question to you is this: what gets damaged? Right? What gets damaged, and is it permanent? Right? So what I want to do is I want to share with you. Deborah says, "Does it ever rebuild?" Helene says, "Is it? Can it be irreparable?" Dorothy says, "Can it be permanent?" Great questions. Great questions. I want to show you some of the latest reports on what part of the village is being damaged. Does that sound good? I'm going to share my screen with you guys. I want to show you the latest reports on what part of your village is being damaged. Let's see here. What is this? Oh, this is Facebook. Yay. Let's see. Let me pull up my page, and I'm going to show you the reports so you'll get a good understanding on what can be damaged, what part of your village is damaged from post-COVID, right? From COVID after the virus is gone. Let me pull this over here. Let me pull up the chat box so I can see you guys over here. You like how I'm moving things around here? And that way we can see you guys in the chat. Okay, I'll put it over here. Let me show you some reports. American Lung Association, guys. American Lung Association on post-COVID recovery. And the American Lung Association has a huge post on this post-COVID recovery, because one of the organ system that is mostly damaged is your lungs, right? One of the organ system that is mostly damaged is your lungs. So that is a building in your village, right? That's been shot up. One of the main reasons I admit patients to with COVID in the ER is COVID pneumonia. Right? COVID pneumonia is one of the primary reasons that we admit patients with COVID in the hospital, because it goes straight to your lungs first. Look at all the symptoms that are associated with damage to your lungs. Have you guys seen these symptoms before, guys, in patients with COVID? Type in yes if you've seen these kind of symptoms: shortness of breath, cough, chest pain, fatigue. These are the symptoms of post-COVID pneumonia, okay, of recovery from post-COVID. Pretty crazy, isn't it? So the American Lung Association has an entire section on this because your lungs is one of the big organ system that is affected. But it's not just the lungs alone. Take a look at this, guys. This is an article, NPR. 1 in 5 after COVID, 1 in 5 develop some type of mental disorder. Is that not crazy? It just shocks me. I mean, looking at these kind of things, right? How many of you guys know someone who's had COVID and although they have recovered from COVID, the virus is gone, but they're still suffering from anxiety, depression, insomnia, PTSD, still after 3 months? How many of you guys know folks who have gone through that? They've recovered from COVID, but they haven't really recovered from COVID with that. Right, Dana? You've heard that as well, right? Mental health, guys, huge issue post-COVID. Imagine that 1 in 5 huge issue post-COVID with that. It's just crazy. I mean, we don't see this with the flu, do we? We do not see this with the flu. I mean, you get sick from the flu, you recover from the flu, and you're fine, right? The flu should not cause all this. It's Susan, it's probably a combination of both, but I'm sure having the infection probably worsens things with that. Okay, 1 in 5. This was published in the Journal of Lancet Psychiatry with that. So COVID affects the brain, as you can tell. COVID affects the lung. COVID affects the brain. How many of you guys have heard of brain fog? How many of you guys have heard of brain fog? Yeah. How many of you guys feel like you have brain fog? Type in yes. Nice, right? And so, yeah, your friends have been, or just weed? What? Right? Sometimes. Look at this. Do you know why you get brain fog? Does anyone know why you get brain fog with COVID? Any thoughts about that, guys? Inflammation, don't know. Blood clot, lack of oxygen. Yeah. Are you guys able to see my screen, by the way, with that? So the brain, huge issue. How many of you guys have heard of folks who have had COVID, they lost their taste and smell, and it's not back yet? Type in yes if you've heard of folks who have had COVID, they've lost their taste and smell, and it's not back yet. Do you know why that is? Sena recovered twice too, hung himself. Oh my gosh. A friend told me his neighbor recovered 2 times. His wife found him hung himself and died in the garage. So sorry to hear that. Tina, you've lost taste and smell after 6 months. Let me show you guys. Oh, a friend. Okay. I'm glad you can taste and smell, Tina. That's a good thing. How does COVID? Oh, Mabel says olfactory nerve. Okay. How many of you guys know what the olfactory nerve does? Does anyone know what the olfactory nerve does? Let's look it up. Let's look up the olfactory nerve here. Let's look at some images with that. Yeah, this is the nerve here, guys. This is the nerve. COVID first enters what? Your nose, right? COVID first enters your nose. It can enter your mouth and occasionally through your eyes. As COVID enters your nose and is on its way to your lungs, right? The olfactory nerve that allows you to smell is here. It's connected to your brain. So when COVID is hanging around here, where else does it go? Where else does the virus go, guys? The virus goes up, straight up into your olfactory nerve, right? It goes straight up your olfactory nerve on its way to your brain. And as it goes up your olfactory nerve, it damages the nerve. And in the process of that damage, guess what? You cannot smell, right? It takes away your ability to smell, goes up to your brain and causes brain damage. This is why you lose your smell, right? The virus physically travels up the nerve. How do we know that? We know that because we've done biopsies, right, of the nerve, and we can see the virus inside your olfactory nerve, right? We can see the virus inside your olfactory. Let me see if I can look it up. COVID inside olfactory nerve. Let me see if we can find a picture of that, guys. Let's look up images. And yeah, I've seen some images here with that. Here you go. New evidence that cells in the nose are a key entry point for COVID-19. And what they've seen is they have basically mapped out and located the presence of COVID-19 itself inside the olfactory nerve as it travels up. So through these, sophisticated microscopes and autopsies and all that stuff, we can actually see COVID inside your nerves now, guys, especially the olfactory nerve. And that is behind the loss of smell and taste. Does that make sense to you guys so far? And the thing is, when the virus goes through your olfactory nerve and it goes up to your brain, right, it causes issues with your brain. It causes cognition problems. It causes memory issues and things of that sort. Okay. Does anyone know that coronavirus can cause kidney injury? Does anyone know that coronavirus can cause kidney injury? Have you guys heard that before? Most of you guys have not, huh? Most of you guys have not. Yes, here it is. Here it is, COVID pandemic causing acute kidney injury and impact on patients with chronic kidney disease and transplants with that. And I, is Dr. Lee here? Dr. Lee, are you here? I'm gonna see if Dr. Lee is here. We have, let's see here.
I'm here.
Oh, good. Where are you?
I'm hiding like church mouse, listen to your talk, and you have a lovely group here. I just enjoy every minute of it.
Let me see if I can find you, Dr. Lee. There's 3 pages I have to look through to find you. I want to bring you on because Dr. Lee, guys, is a nephrologist, a kidney specialist, and I would love for you to share a little bit about how COVID affects the kidney. If I can find you. Where are you? There's like a whole bunch of ladies here. Where's the guys?
Well, I can't get it. Let me try.
Hold on. Are you able? Oh, yes. Hold on.
Right. Okay, good. Yeah, good evening, everyone. And so enjoyed talking, listen to your conversation, and it is a great information. And I think Dr. Trent had wonderful information to share with everyone. Being a kidney doctor, I get involved, and unfortunately, the virus is a very different kind, not like a flu, which comes and goes, but this left a corroded damage and very serious damage in the body. And the kidney is no spare. In fact, from Cleveland Clinic and the NYU, people hospitalized, about 1/3 have kidney damage. And among those, probably about 25% want them on dialysis. And worst of all, I think about some 25% would result in the chronic kidney damage, losing probably about half the kidney function.
Wow.
Eventually, and that become a really public health issue in the future, because you just look into how many individual come down with COVID-19, and then a large proportion of them wind up with kidney damages. It causes about 5 different kind of kidney damage in the body, and different special term affect the filter, and immune system clog up the filter through the very awkward reaction because of, as Dr. Trim pointed out, inflammation factor are really damaging, just like corrosive effect in the system, in the one of the filter, for example, and that get everything clog up. When the kidney clog up, it begin to scar up, and then you obliterate the space and won't let the poison filter out. And that's what a big problem is. And the only thing we're not sure at this point is those had a positive COVID, but not ill. What happened to them, we don't know, because you probably know about only about 13 to 18% of COVID positive becomes ill, becomes sick. And there are almost about 80% they are not ill. And what happened to those people is just really something. In fact, Dr. Trin and myself are in a process finding out those asymptomatic COVID positive individual. And that you look at how massive the infection has been, and so that become a big public health issue eventually. So Dr. Trin, myself, and other team working together try to solve the issue, and maybe identify risk factor, prevention, mitigation, and then hopefully avoid the crisis management in the future. And it's really a big issue. I think for those who had the infection, they should have the follow-up test, check the kidney function, in the percentage of the kidney function work, and also look into the protein leakage in the urine, because when the kidney got damaged, there's always a new symptom of the leakage protein in the urine. And that you can do a dipstick, but that is not reliable. It's better measure the amount of protein in the urine, quantitative measurement. That's probably more reliable. And given the, you could have lung problem, but still survive by kidney, you don't take care of those, and there is damages and wind up on dialysis, and that's something really absolutely needed to prevent. So this is something we are in a process finding out, and but it's not an issue, unfortunately, being mentioned by anybody. You have all the report from the institution, academia, but they don't have access to those positive, but without a symptom, and that's what the issue is. And I think Dr. Trin, the team have been working in the Anaheim Convention Center, and there we found it out about 7% positive, and in LA up to 11, sometime about 13% positive. That means a huge number of individuals with positive tests, and yet we don't know what happened to those people. And it's just a lot of long hauler, not only the lung problem and other issue, brain problem, but could also have the heart trouble. And also have the, some will become a new diabetic. Then they are not diabetic before, become a diabetic. And so it's really the problem is coming up, bring up attention. And, but again, unfortunately, all the reports so far are from institution in hospital academia, like Cleveland Clinic, NYU, or London and so forth. But again, I see the question here, is there a way to avoid more damage to the existing pre-existing kidney disease? Yes, you have to have certain medication. We call it ACE, ARB, and also the SGLT2 inhibitor, and then you got cut down protein, use the vegetarian protein. Don't help, and then get checkup all the time, control the pressure, you got to exercise, and then you got to control the sugar and control the weight. So you kind of general and also more specific target medication available to do that. And diet, I think so Nelly's mentioned was what asking about diets. The test, in fact, you have to check ask your doctor, check my kidney function in percentages, such as we call EGFR, G like girl, F like forest, R means Richard, GFR. And also the urine protein creatinine ratio. And I would suggest, even without any symptom at all, you should have doctor check that if you are positive with the COVID test, because it's a high prevalence of the kidney disease. And when you're over 65, even more, because unfortunately the age comes with some price. And if you have diabetes, hypertension, then even much worse, because nowadays personal dialysis, about 2/3 are caused by diabetes, hypertension. So when you have those plus COVID-19 test positive, you must get the test promptly, so that you know the status of the kidney, and then maybe go to see the kidney doctor to have some advice or something what to do. And I think the clinic Dr. Trin work has some arrangement to be made for the kidney clinic, so that I think will be useful to do it, so that you don't go through the primary care, you don't go through the referral. You can just directly get the test done very quickly. And it's just basically there are 5 organs, and Dr. Trin talked about the lung, the brain, and there's a kidney, and there's a heart. And also remember, those without diabetes can become a new diabetic because of the pancreas was attacked by the inflammation factor, all this strong inflammation factor. Well, that's a lovely picture. That is your family, right?
Yes, you can keep talking. I will show some of the, as you talk, I'll show some of the links.
Yeah, and it's really, nowadays, it's not so bad because there's more people getting vaccination now. But early on, in the previous about 8-10 months or so, before the vaccination become very prevalent, I think that a lot of people, there are more people with the positive test, and that I kind of worry about them, because I don't know how they would follow up all the issue we mentioned now. Because, for example, the heart disease could give arrhythmia and begin to have trouble with the we call cardiomyopathy or myocarditis or something, because of the inflammation factor attack the heart muscle. Likewise, for the pancreas, you have the inflammation factor attack the pancreas, and the kidney likewise too. It's just so see this the slide shows as Dr. Trin was try to explain to everyone here. And the heart is big issue. It comes in the arrhythmia, irregular heartbeat, skipping, atrial fib, sometimes trouble breathing with the weakness of the heart function, just we call the cardiomyopathy. And of course, the lung is going to be affected. You need to check that to find it out. And then you need to check make sure you get A1C or some test to be sure that you don't have a new diabetic once you have COVID positive, even though you have no symptom, because it could gradually come on. So those are something, unfortunately, unlike the other flu, just comes and goes, right? 3-4 days or so, they're gone. But this is different because it's a very corrosive damage to the system. I mean, affect almost every major part of organ in the body.
Thank you so much.
Thank you, everyone.
Thank you so much, Dr. Lee. That was great information. Appreciate your specialty and your knowledge on that.
You got a wonderful group of the people here. I see they're so relaxing, and you get information and learn from everyone, and that's wonderful. I'm just so impressed and so excited about this.
Glad you're
Wonderful,
with us.
lovely
Yes,
people.
thank you. So you guys saw those links I showed with COVID and heart disease, COVID and right. Look at this. Half of patients in this one study, half of patients with severe COVID have lasting heart damage. Isn't that just crazy? I mean, when you think about it, that's just another building in the village that's been destroyed by COVID, right? A building that's called the heart. And and we talked about diabetes, and we have noticed, guys, lots of new cases of diabetes in patients who have been infected with COVID. Why is that? Well, damage, inflammation that results in the pancreas, and uh, and and so as a result, that is another building in the village that your village that has been destroyed. And we can go on and on. We looked at the brain. We looked at the right. We looked at the kidneys. Just about every organ so far, guys, have been damaged. This is again nothing like the flu, is it? Uh, how do you detect a lot of these problems? Dr. Lee mentioned for a kidney test, you can do a blood test to look at your kidney function. You can look at what's called the glomerular filtration rate, right? How well your kidney is filtrating, right? That's a simple blood test. You can do a urine test to look for any excessive protein that's in the urine that may have leaked from the kidneys due to damage to your kidneys. If you want to look for any issues with diabetes that is associated with COVID, simple blood test, right? You can look at the hemoglobin A1C, which measures your last 3 months sugar. You can look at the fasting blood sugar to evaluate for diabetes. Those are some of the testing that can be done. If you want to be evaluated for heart conditions post-COVID, usually these patients have some heart symptoms. They have chest pain, they have palpitations, right? Dizziness from heart arrhythmias and things of that sort. These types of testing can be looked at with EKGs, right? That can measure your heart rhythm, or Holter monitors that can look at your heart rhythm over 24 hours. Stress tests, if there's any issue or fear of clogging of the arteries. Echocardiogram, which is an ultrasound of the heart to look to see if there's any damage or weakness to the heart. Those are the testing that we would recommend for heart evaluation, right? Pancreas evaluation basically is the blood test to look at hemoglobin A1C for diabetes. Kidney evaluation, that's a blood test to look at the kidney filtration, the urine test to look for any damage. Um, Everyone's taking notes, right? I'm just kidding. I'm going a mile a minute here. What other organs? Lung, pulmonary, right? How do you know if you still have pulmonary or lung damage, right? As a result of COVID, if you still can't breathe and you're still short of breath, are there testing that can do that? The answer is yes, there is testing. If you've had, pneumonia from COVID, you can do follow-up chest X-rays just to make sure that that pneumonia has resolved. If you can't breathe well and you want to look at any internal damage, you can do a test called a pulmonary spirometry. Anyone heard of a pulmonary spirometry test before? Where you breathe into a little device and it measures your lung capacity. It measures how well your lung function is. That's a test that can be evaluated to look at your lung function for coronavirus infection damage, right? Um, Crystal, yes, Crystal had that. Yes, if the PFT, that's right. So that's a way to evaluate your lungs. Brain issues, guys. brain issues, post-COVID brain fog, depression, things of that sort. We have testing for that as well. We have testing for that. And, and what that entails is there are several types of tests that can be done to screen for mental health, right? To screen for depression, anxiety, things of that sort. There are some cognitive testing that can be done for that. Um, and so there are testing for memory. We can do the MMSE test, mini mental state exam. So there's different types of testing that can be done for the brain as well. Crystal, you had COVID, right? You had COVID. Crystal Bodine here says,
Yeah, I did.
are you here, Crystal? Where are you at?
I was on mute.
Where are you at? Maybe you can share your COVID story real quick with us for a little bit of time.
Sure.
Oh, there you are. Hold on. I'm going to bring you up here. And yeah, tell us about your situation, Crystal.
So I had COVID in July and was actually hospitalized in Fountain Valley. So I was hospitalized initially in ICU because I had a pneumonia, and then eventually got stepped down to telemetry, and then came home after a week to try to recover at home. I lost my ability to walk and couldn't even make it up my stairs. Probably spent 2 months sleeping on my couch because my lungs were just so bad. And so when I started to walk, it was a little bit of a slow recovery. So now I'm, maybe 8 months post-COVID. I kind of lost count. And I'm still having some side effects. I had lost about half of my hair, which is starting to grow back. Still having some lung issues, having memory issues, brain fog. I did the PFT test that you mentioned. I've done a chest x-ray. I go to a neurologist soon, and I'm going to a heart doctor soon, a specialist, because there's a lot of inflammation in my body right now, and some possible damage there. So just doing the best I can to try to take the tests that I need to take and eat well and take vitamins and do what I can control, because COVID just really took over my body. And really the main thing right now is the memory issues, forgetting words, names of things, really simple things. I could be in a meeting for work and just completely lose my train of thought, which wasn't something that I had post-COVID. So dealing with that, I do physical therapy because I have a lot of muscle weakness and pain, a lot of pain in my spine and lower back since COVID. I had kind of a stiff neck even after COVID where I couldn't really move. So I've been doing physical therapy for a few months to just recover from that. And again, just doing what I can to control these like post-COVID after effects.
Did you have any pre-existing problems, or were you pretty healthy prior?
No, so I'm 35 years old, so I'm not too old. I would say that, yeah, I had some weight to lose, but I wasn't like extremely overweight, and I didn't have any pre-existing conditions. I did have like bronchitis as a kid, maybe once. Mm-hmm. So yeah, I had, that, I guess, if you want to consider pre-existing, but no diabetes. My blood pressure is perfect. Nothing like that.
Right. So you can certainly, be relatively healthy and still end up in the ICU, huh?
Yeah. In fact, I tried to recover at home initially. I have 4 children and I just didn't want to leave them. And so I was at home for probably 4 days with fevers and symptoms. And then it just got to be too much. My oxygen was dipping in the 70s. I couldn't breathe. And that's when I just decided to go into the hospital. And I was pretty bad at that point. I should have gone in a bit sooner. But again, I was thinking, I'm young. I hear people recovering from this. And I just didn't think it was as serious as it was until maybe day 4. And I just really needed to go in,
Well, glad you're here with us.
Yeah, me too.
Thank you for sharing. Appreciate
Of
it.
course.
All right. Yeah, guys. So COVID, as you can tell, can damage an entire village. Can damage an entire village. Can damage the buildings in each village, and each building in your village is an organ, right? There's a building that is, your brain. There's a building that's your heart. There's a building that's your lungs, your pancreas, and so each building, in your village is basically has gone through the ravage of a battle between, the virus and your immune system, and the virus leaves, but there's damage to every building, and that's why you're seeing what we call long hauler symptoms. So yeah, right, Eric? Yeah, that's what long haul symptom is. And again, it has nothing to do with the flu. Everyone says it's the strong flu. And as you can tell, it has nothing close to the flu with this. I am in the process of developing with a team of physicians a program to help patients who have gone through, COVID and are still not recovered yet. Right, their lungs have been damaged, their heart's been damaged, their kidneys been damaged, their brain's been damaged. So I'm part of a team with physicians developing a post-COVID rehab program. How many of you guys know someone who could benefit from a program like that? Right? Type in yes if you think you know someone who can benefit from a program like that. That if that program exists, because these programs don't exist uh, in most areas of the country. You go to your doctor and you're like, I had COVID. I'm still not better yet. What do I do, doctor? And most of your doctor says, they're not sure what to do. And we're in the process of building and creating a program specifically for patients who have, long haulers or long COVID and things of that sort. As soon as we're closer to launch, I will let you know. Does that sound good? And you can certainly let your friends and family who have recovered from something like this know about what we are planning to, to create to take care of our own patients in our community with that. Yeah, and so guys, we're toward the end of the hour. We will be here every Thursday, as you know, and we will continue to chat without this. Let me see. How can you contact us? How can I contact you? If you're on my mailing list, you'll be contacted. Are you on my mailing list? I don't even know. If you want to go on my little email list, it's just my name. Let me see here. Let me send you a link here for you guys. Yeah, if you're not in my little email list, you can go to my name, my website. It's just dungtrinmd.com, and you can get on my my mailing list. But once we're ready to launch this program, definitely we'll let you know. And until then, we will see you in about a week. What do you guys want to talk about next Thursday night? Anything interesting? You want to talk about CBD, more COVID, food, favorite foods to eat? The answers, Alzheimer's prevention. I think we did a talk not too long ago on a blood test that is out now to detect the Alzheimer's plaque. That was interesting. How to reduce inflammation. Ooh, the new strains of COVID. Yes, then we can talk. There are new strains of COVID out that we can share with you next week. Carol says 60 minutes, they talk about another drug called fluvozamine. Yes, yes. So lots of things we can chat about next week. Same link as last time. And until then, guys, we're actually finishing on time. Yoo-hoo! Take care, guys, and feel free to send this link to your friends and family. And if they, if they want to be involved in what we do. Oh, what's the link? It's just a website. It's just and the website's just my name. It's let me see, dungtrinmd.com. That's the link. The link is just a website with my name, and folks can just put in their name and their email, and they'll get the link to this Thursday night. All right, God bless. See you guys
Thanks,
later.
Dr. Tran. Thank you.
You're welcome. I hope you guys have some dinner.
Thank you so much.
All right, take care.
Okay, bye.
Thank you.
Bye-bye.